many of us are feeling it. Spring is upon us, and so is allergy season. And the changes in our weather are not helping. So what can we do to get some relief?
We're joined now live by Dr. Marc Kerner, an ear, nose, and throat specialist with Dignity Health Northridge. Welcome, doctor.
Great. Thank you for having me.
So first, when is allergy season in Southern California, and why does it appear to be getting worse?
Well, for one thing, we had a lot of rain this year, so that stimulates a lot of pollen and a lot of tree dander and all kinds of other allergens that are now really in bloom. And so we're seeing a huge amount of allergy intake right now.
Dr. Kerner, I think everyone I know has this dilemma. How can you tell the difference between whether you're suffering from allergies versus a cold?
Sure, great question. So a lot of people that have allergies have them year over year, where their symptoms recur seasonally, whereas with a cold, you typically get the same kind of symptoms, which can be a congestion, nasal congestion, runny nose, itchy and watery eyes, but a cold will generally last just a few days and then go away. And you may have, whereas allergies will come and go and from year to year.
My husband and son have terrible allergies, so I feel like I should know this answer. But what causes allergies, and can you develop them later in life?
Sure, you can. And what happens is the allergens or the pollens that are in the air or any of the irritants, what happens is with repeated exposure, you stimulate your nasal membranes to produce all kinds of antibodies and histamine, which then results in the symptoms of the congestion, the mucous membrane swelling, the runny nose, and the itchy eyes. So that's the real basis of all of this. And so the treatments are based on trying to control that histamine production and reduction of those allergens into your nose.
Oh, well, Dr. Kerner, speaking of the treatment, what can folks do to manage the symptoms, and does it differ between children and adults?
Sure. Basically, they're the same. The things that we do, the hallmarks are really nasal irrigations and nasal flushing with saline solutions to try to help to eliminate those allergens from the nasal membranes. And then after that, there's oral antihistamines and decongestants, which are very helpful for symptom control, as well as topical nasal sprays, which are either steroid-based or allergy-based, and they're helpful too. They can both be used in adults and in children. They're safe for both. The dosage vary, obviously, but they're both very safe, and they can be used for long periods of time.
Yeah, speaking of periods of time, is it safe to take, like a Claritin or a Zyrtec every day? And when should people consider seeing a specialist?
Sure. So those things, those medications now, are almost all of them are over the counter, so they've been deemed safe. We've had patients on them for many years. It's very, very safe to be taken for years. And I think when the allergies are so bad that you can't control them with the over-the-counter or topical medications, then it's time to see a specialist, whether there's some anatomic abnormalities or somebody that may actually benefit from immunotherapy, which is shots, based on whatever allergens that we find that they're allergic to.
Yeah, great information, great advice. Dr. Marc Kerner, thank you so much.
Great. Thank you for having me.
Appreciate that.